COVID-19 and African Americans by Dr. Kwame Nantambu, May 7, 2020. By permission, I am audioing this article. Indeed, one of the most tragic and realistic fallouts of the novel contagious COVID-19 pandemic in the United States is its most violent and deleterious impact attack on African Americans. Population statistics reveal that African Americans comprise 13.4% of the national population, but yet account for the following. In May 2020, Wisconsin African Americans are only a miniscule 6.7% of the population, but have accounted for a whopping 32% of COVID-19 deaths. In Michigan, African Americans account for 14% of the population, but 40% of the state's COVID-19 deaths. In Missouri, African Americans comprise 12% of its population, but 40% of its COVID-19 deaths. While the Center for Disease Control and Prevention, CDC, points out that nationwide, African Americans are 33% of all hospitalized cases. Why is that? At the outset, it must be realized that persons, albeit elderly persons, with pre-existing medical illnesses such as diabetes, hypertension, and heart disease are the ones most easily prone to be infected with COVID-19 coronavirus and eventually die. Needless to say, this group of such persons is made up of African Americans. Why is that? The salient fact of the matter is that for umpteen decades, African Americans have been the overt victims of benign neglect by successive administrations in terms of a national public health policy. And to further compound and completely exacerbate this current unequal health system, one finds that President Donald J. Trump is still pursuing his dogged ultimate intent to terminate Obamacare for all. Moreover, one needs to wonder why epidemics always seem to only directly target the poor, marginalized, and least of these in society. Why is that? As the COVID-19 coronavirus pandemic continues to spread across the United States, it is really constructive and significant to note and observe that the majority of Americans among the 30 million who recently filed for unemployment benefits were not African Americans. In other words, there now exists in the United States a profound new reality situation where white Americans are suffering economically while their counterparts, African Americans, are dying disproportionately, or put another way, white Americans are losing their jobs while African Americans are losing their lives. Why is that? It is at this crucial juncture in health care public policy decision making process that a common bipartisan national plan should and must be implemented. Otherwise, the country would just be reiterating and reinforcing the infamous conclusion of the 1968 Commission report on race riots in the United States as follows. The nation is moving toward two societies, one black, one white, separate and unequal, a system of apartheid in its major cities. The truism must neither be forgotten nor overlooked that COVID-19 is no respecter of persons. This coronavirus couldn't really care whether you're black or white, rich or poor, Democratic, Republican, or independent, lived in suburbs or ghetto, and even if you are an American or not. Truth be told, the COVID-19 coronavirus pandemic's only final supreme decision is that as long as you are a human being anywhere on this planet, I will infect you and kill you, period. Case closed. End of discussion. Now is your turn to stop me. In the final analysis, now is the opportune time for all Americans to heed the poignant but apocalyptic admonition of slain civil rights leader Dr. Martin Luther King Jr. To the extent that now the judgment of God is upon us, and we must either learn to live together as brothers and sisters, or we are all going to perish together as fools. Or in the 1980s revolutionary jargon, none of us is free until all of us are free. Shem Hotep. I go in peace. Dr. Kwame Nantambu is Professor Emeritus, Kent State University, USA.